Well, welcome, folks, to this edition of the 700 Club. It's wreaking havoc in America. What's called the Delta variant is surging, with 4 times as many cases of COVID compared to last fall and double the hospitalizations. And now a new strain has reared its ugly head. It's called the Mu variant. So what's our best line of defense? And could we be looking at 3 doses of vaccine? Here's our medical reporter, Laurie Johnson.
A new milestone. 75% of American adults have now gotten at least 1 dose of the COVID-19 vaccine. Still, hospitalizations and deaths remain high, largely among the unvaccinated or those without natural immunity. Football season kicked off with hundreds of thousands of screaming fans packed shoulder to shoulder into stadiums. Only 5 college teams and 3 professional reportedly requiring proof of vaccination or a negative COVID test before entering. Despite CDC warnings against unvaccinated people traveling over the Labor Day weekend, the TSA screened 3.5 million air travelers, back to pre-pandemic levels. Highways, beaches, and national parks all packed.
I'm hoping we're not going to see a major spike, but after every single holiday, we have seen a bump in infections and hospitalizations and deaths.
Meanwhile, as children return to the classrooms, heated debates over whether they should wear masks.
No more masks!
Just in the last week, nearly 252,000 children tested positive. That's 1/4 of the total number of U.S. cases, prompting 1,400 schools in 35 states to revert back to distance learning. While most hospitalizations and deaths are among the unvaccinated or those without natural immunity, new data shows vaccines aren't as effective as they once were, prompting calls for boosters as early as this month.
From my own experience as an immunologist, I would not at all be surprised that the adequate full regimen for vaccination will likely be 3 doses.
And while the Delta variant makes up 99% of all U.S. cases, there are reports of a new variant, Mu, in 49 states.
While we have a concern that Mu could evade the vaccine, it's not spreading fast enough to be a real concern yet, but the jury is still out.
While cases of the Mu variant are being closely monitored, health officials have their hands full with Delta cases. Today, President Biden will outline a 6-pronged strategy intended to fight the spread of the Delta variant and increase vaccinations. Officials say that strategy is likely to include mandates, testing, and schools, along with getting the private sector to do more on the issue. Pat.
Larry, I want to ask you a question. It's like somebody turned a switch and suddenly from having no fans in the stadiums are just suddenly packed with people cheering. The golf courses now, they didn't used to have any spectators. Now there are thousands of them. What happened?
Right. Well, a lot of people are vaccinated, Pat. And so you look at those stadiums and you think, wow, I mean, it is outside. And we have to remember that if there's a breeze blowing, that the chances of infecting another person are very low. But then you do have to factor in the fact that you're jam tight in those stadiums and you're yelling for 2 hours straight if you're doing it right. And so but the good thing about those college games is a lot of those students are actually vaccinated. In fact, 1/4 of colleges and universities mandate vaccines for the students, and 70% of colleges and universities have some sort of incentive program for the kids to get vaccinated. And so we might assume that a lot of those fans are vaccinated, and certainly being outside helps.
Have we hit what's called herd immunity yet?
Well, it's really difficult to say about herd immunity, and health experts are saying, no, we haven't hit herd immunity, simply based on the fact that this COVID, this Delta variant is so damaging and so deadly. Right now, we're hovering around 150,000 new cases every day, Pat, and 1,500 deaths every single day. And so that's a huge increase from where we were in June. And now things are sort of settling down in the south where it was so bad, but moving up to the Great Plains states and the Northwest. So it looks like this Delta variant and the ravages of it are going to be with us for a while.
Well, now, these vaccines that we've taken, now they're talking about a booster. Could you compare the various vaccines? You've got Moderna, you've got Pfizer, and then you've got the J&J. Which is superior, do you know?
Well, actually, there's a Mayo Clinic study that shows the Moderna vaccine is better at fighting the Delta variant than the Pfizer vaccine, and it wasn't compared against J&J, although that study has not been peer-reviewed yet. It looks like what's going to happen is Pfizer may be recommended by the FDA to have a booster shot beginning on September 20th. Pfizer got all of their information into the FDA before Moderna. Moderna apparently has submitted their information, and those booster shots could be coming about a week later towards the end of September. But Pat, J&J folks such as yourself are sort of left out in the cold because there really hasn't been very much data as far as how those vaccines are performing and what's going to happen regarding booster shots.
Well, so far with J&J, I am a happy camper. I mean, I had no results. I mean, it's just tremendous. Not even a sore place where they put the vaccine in. I hope and pray that one gets cleared and they say good things about it. But let me ask you one thing. The word was the little kids didn't get this. And now, apparently, a lot of little children are getting sick. Now, what's the story on that?
The story is one word, Delta. Delta changed everything. And so, right, the kids are getting this a lot. And a lot of schools, unfortunately, are closing because of the outbreaks. And we're seeing hospitalizations, 2,500 kids hospitalized, Pat, in just the last week alone. Overall, 470 children have died from COVID during this entire pandemic. So even though those numbers are terrible regarding hospitalizations and deaths, severe illness like that is still very rare, but we are seeing a lot of cases.
Thanks, Lori. Ladies and gentlemen, I want to tell you, this disease is horrible. The effects are deadly. It does terrible things to your lungs. It actually can affect your brain, and it is a lasting problem. And to sit there and say, well, I'm not going to take the vaccine, I think is nuts. I had the J&J if it's available to you. The others, you know, if Moderna is a good one, whatever. But there are clinics set up all over the place, and it's usually a free thing that you can get. And absolutely get vaccinated. You know, when I was a kid, everybody got a smallpox vaccine. I mean, that was just standard. And smallpox was eliminated because everybody got vaccinated. And there's nothing sinful about it. It's not the mark of the beast or any of these other things. It isn't some nefarious plot. And I really, really recommend that you do it. Unless your doctor says, well, you can't do it because you've got something else wrong with you. Well, in other news, it's a terrible thing. COVID, cyclones, an earthquake followed by a flood. The country of Haiti has been crippled by natural disasters on top of an economic and political upheaval. The survivors of these disasters have nowhere to live, no clean water to drink. But who has been bringing relief and going into areas no one else wants to go? Heather Sells has that answer.
It's hard to overstate the devastation in Haiti right now. On top of political and economic crises, the August 14th earthquake killed thousands, and it damaged both homes and schools.
This region has been affected by multiple shocks. Economic crisis related to COVID, cyclones, earthquake now. The earthquake that hit left all these people with nothing.
It killed 2,000, injured more than 12,000, and destroyed 53,000 homes. Just 3 days later, Tropical Storm Grace flooded the streets. After all this, hundreds of schools must now be rebuilt or repaired, forcing the government to delay the start of the school year. Operation Blessing spokeswoman Emanuela Del Swan tells CBN News Haitians have no idea when classrooms will open.
Too many schools has been collapsed, so the Ministry of Education has to postpone the re-entry. but everyone is wondering how.
The earthquake struck the southwest part of the country, cutting off access to roads and making the relief effort to remote areas even more difficult. Operation Blessing has targeted those communities.
When we meet with the Ministry of Health, the government, we say we don't mind going where other people doesn't want to go, because we are here to serve the most needy people.
And they are serving by sending food kits, water and filtration systems, along with medical brigades to the hardest to get to areas. In the southern port city of Lakai, Samaritan's Purse also brought in an emergency field hospital.
We brought in a lot of medical relief supplies, the infrastructure we need to operate in this kind of environment where there's little electricity. So we came fully prepared and self-contained.
While the aid is welcome, it's not near enough. Operation Blessing reports that health facilities are overwhelmed. More than 100,000 need clean drinking water, and there's growing risk of disease, such as cholera and malaria. Thousands of families still have no place to sleep after their homes were destroyed. And following the July assassination of President Jovenel Moïse, gang control and violence are on the rise. That is chasing away potential foreign investors, slowing down relief, and destabilizing the country at the very moment it needs to come together. Del Swan says Operation Blessing is trying to help the Haitians regain their hope so that they can begin to rebuild their lives. Heather Sells, CBN News.
This terrible suffering. Operation Blessing has been operating. We noticed, we showed Samaritan's Purse. We congratulate what they've been doing. Operation Blessing has been down there, and it's called Disaster Relief Fund, and that's just one of the countries we are helping. But when you think of Papa Doc Duvalier, you think of Baby Doc Duvalier, you think of what was called the Tonton Macoute, the awful suffering of those people, not only under natural disasters, but under a dictatorship. And then they had a guy named Aristide who was as bad as any of them. He was a butcher. And all the way up and down the line, those people have been terribly suffering. And, well, at Operation Blessing, we were glad to help them if we could. And we want to help people. So if you want to help us, help others. And this is just one of the places Operation Blessing is working. Just pick up your phone, call in and say you can count on me. It's 1-800-700-7000.